Joining me now is Scotland's National Clinical Director, Professor Jason Leach. How does where we are now compare to where we were 12 months ago?
Well, there's good and bad in there, Christian, and good evening. We are on our fourth variant, and we're unfortunately on our second Christmas variant. The timing could not be worse for families and for businesses and retail. But the virus doesn't have a calendar like you and I have one. That's the bad news. The better news is last Christmas we had no vaccine. This year we have vaccine. We also have extensive testing around the whole of the UK that is available for free. That's not true in every country of the world. So those two pieces of science are new and make a huge difference this Christmas compared to last Christmas.
And if you look at the numbers of deaths, they don't seem to have gone up in the same way that the number of cases is doing so. Why is that?
Well, it's horrible to have to talk in those terms, isn't it? Because we just saw some families on your previous clips who have lost loved ones. It's a tragic disease. I'm quite sure it's touched your family, it's touched my family, it's touched millions of families around the world. There are 12 million dead globally, at least 12 million dead. But you're right, vaccines in Europe, we know for sure, have saved hundreds of thousands of deaths. In Scotland, our number is around 27,000. So 27,000 alive who would have been dead. I'm sorry to be so blunt, but that's literally the life-saving element of vaccines. And the important data today is that 2 may not be enough. So the Joint Committee, once again, have preempted that science and said, get your booster and get it fast. And that's why you see us trying to do that.
What is it that the third jab is doing that 2 don't? Is it that there are more antibodies going around your system, or what?
I wish it were as simple as that. Think of immunity a bit like a dimmer switch on your lights rather than a light switch. So it's not on or off. It is up or down. And you can't tell by looking at you how immune you are. But on average, around the whole population, to turn that dial up with this variant, you need a booster dose. There's all kinds of stuff going on in the background there that we'd need a proper immunologist on your show for rather than me. But fundamentally, it's cells and antibodies, and you need both. So natural immunity comes from the disease. Artificial or vaccine immunity comes from the vaccine. So to turn that dial up, let's say we want to get it to 11, then you need to get those 3 doses. And that's what the early data in South Africa told us, and it's what the UK data is now beginning to show us. So get that booster dose. I vaccinated yesterday afternoon for the first time. I signed up, did a shift in Glasgow's vaccine centre, and it was absolutely fantastic. It was so encouraging to have conversations with people who are coming forward to get their booster doses and really, really keen to get to Christmas boosted. And that would be my fundamental advice to the population.
Right, but how worried are you about the NHS being overwhelmed at this stage?
Yeah, I am worried. My colleagues in the National Health Service are finding it really, really difficult. And one of the reasons for the change in tone over the last few days from all of the public health advisors, you can't have missed that if you've paid attention. And even from us at lunchtime today with the First Minister, the tone is changing because we're worried about this Omicron wave. And we're worried about it not just for the individual health of the population, but also for everything else that's happening in the health service, but also other essential services like supermarkets and media and everywhere else where you need people to be at their work. And if they're sick, they're not going to be at their work. So that self-isolation rule becomes really, really difficult for national infrastructure, for health and social care, because we need to keep those things moving. So we're back to the kind of protect the NHS message that we had, I'm afraid to say it's almost 2 years ago, because we've been in this for so long, Christian.
Jason Leach, thank you very much.